Hello, and thank you for listening to today's episode of JATCast, the official podcast of the Journal of Athletic Training. I'm your host, Luke Donovan. For the second episode of the month, I will discuss another article from the upcoming issue of JAT titled Aspects of Technology That Influence Athletic Trainers' Current Patient Care Documentation Strategies in the Secondary School by Dr. Sara Nottingham and colleagues from the University of New Mexico, California State University, Indiana State University, Xavier University, and A.T. Still University. As a reminder, the article discussed today can be found on the JAT website, natajournals.org, and please remember that all content from JAT is open access thanks to the funding from the National Athletic Trainers Association. As a reminder, the article discussed today can be found on the JAT website, natajournals.org, and please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. First step, surveying the scene. Documentation of patient interactions, prescribed care, and rationale for services is an essential component of athletic trainers' responsibilities as healthcare professionals. Other reasons for documentation include a means to track patient outcomes, communicate with other healthcare providers, and to obtain legal protection. Despite the necessity of documentation, several barriers such as limited resources, limited time, and an uncertainty of what needs to be documented impede best practices of documentation. To enhance meaningful documentation across the athletic training profession, it is important to identify both facilitators and barriers to documentation. As such, the purpose of the study was to determine both athletic trainers' perceived strategies for appropriate documentation and challenges in documentation practices. To gain a broader perspective, the authors aim to include athletic trainers who use paper documentation, electronic medical record documentation, or a combination of both. To gain insight from individuals who experience a phenomenon such as documentation, capture an in-depth understanding of participants' experiences, and to reduce bias, the authors elect to use a consensual qualitative research approach. Participants were recruited nationally to account for differences in state practice acts. The recruitment strategy yielded 20 secondary school athletic trainers. The authors developed a semi-structured interview guide to facilitate discussion of documentation strategies, challenges, and perceptions, and also granted an opportunity for open discussion from each participant. The guide was constructed using previous research pertaining to athletic trainer documentation practices and designed in a manner to promote consistency between two interviewers. The complete interview guide can be found within Table 2 of the full text. The interview guide included 14 broad prompts or questions, which included scripted follow-up prompts or questions. Some example broad prompts or questions were, tell me about your background as an athletic trainer. Please discuss what patient care documentation means to you. What are the primary reasons you document patient care? In what ways, if any, do you feel you could evolve your patient care documentation behaviors? What behaviors, if any, do you believe clinicians have toward patient care documentation? Prior to implementing the guide within the study, the survey instrument was reviewed by experts of both design and content and was pilot tested in participants who matched the target population. The interview was conducted over the phone. Additional demographic information was collected by way of an email survey. The results of the interviews showed that athletic trainers practicing in the secondary school setting perceived that several aspects of technology influenced their documentation practices. 3 themes emerged from the interviews, which were 1. Current strategies for documentation, 2. Technological barriers to documentation, and 3. Future strategies for documentation. Specific to current strategies for documentation, the authors found that many of the athletic trainers were using multiple modes of documentation of patient encounters. This theme was consistent even when athletic trainers reported having access to an electronic medical record system. The multi-mode strategy was most commonly attributed to preference of paper documentation, employer obligation, or perceived limitations of the available electronic system. The practice of multimodal documentation is not unique to athletic trainers, but has also been reported across physicians and nurses. Potential pitfalls of multimodal documentation is that critical information may not be included across all forms of documentation. Consequently, disruptions in the patient record and the patient care may occur, as well as a breakdown in communication across professionals. Moreover, studies have found that the combination of paper and electronic documentation resulted in more medical errors when compared to single methods. In fact, overall electronic documentation resulted in the fewest number of errors. The theme referred to as technological barriers revealed that despite the common use of paper documentation, many athletic trainers actually either used or wanted to use an electronic system. However, faced challenges which prompted the athletic trainer to either return to solely paper or combine both forms of documentation. Many participants, which were in agreement to a study of physicians, indicated that the primary benefit of paper was the ability to quickly and in real time document patient interactions, whereas the perceived electronic systems took more time and were often not readily available. The combination of the two methods largely arose from athletic trainers stating that they use paper initially and then transfer the information to an electronic system at a later time. Other studies have noted that clinicians found many electronic systems to have too many options or drop-down menus, which to them greatly increased the time to document when compared to paper. Aside from the length of time, this study found that the network access also influenced the decision to not use an electronic medical record platform. Some of the network issues included disruption to the internet and an inability to access the system from a non-work site network. Although challenges are present, previous literature has shown that electronic systems have numerous benefits over paper, such as increased communication among providers, improve opportunities for data analysis, enhance patient safety, and increase accuracy of data entry. The benefit to challenge ratio is really what drives the third theme, future strategies for documentation. Participants did acknowledge an interest in documenting more using an electronic medical record system, but desired a more accessible and user-friendly system. Concussion treatment was a specific injury where multiple participants reported that the electronic system did not fulfill their needs to be in compliance with mandated state and employer policies. In addition to improving functionality, participants expressed wanting to see the athletic training profession adopt a standardized documentation system with the hopes of enhancing communication and consistency of documentation. In summary, athletic trainers use both paper and electronic medical record formats to document patient care. Most of the dual use was attributed to recopying notes from a paper to electronic format at a later time past point of care. Athletic trainers expressed a desire to use more electronic documentation, but reported accessibility and intricacy of the system as limiting factors. Many ATs support the use of standardized system across the profession designed specifically for athletic trainers. Considering the numerous benefits to electronic medical record documentation, athletic trainers should work with their employees to identify an electronic medical record platform that best meets their practice needs. Well, that's it for today's JATcast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about upcoming podcasts and other JAT events on our Twitter, Facebook, and Instagram accounts at JAT_NATA. Thank you for listening and keep a lookout for next month's JATcast.